So there's a whole bunch of different viruses out there, and typically what happens when you get exposed to a virus is that you get all the viral type symptoms like upper respiratory tract symptoms and cold symptoms, but you can also get the sinus symptoms. During that portion of a sinus infection, when it's a viral sinus infection, it's very contagious, generally speaking, because viruses generally are very contagious. Hello, everyone. Welcome to another episode of We Knows Noses. Today, we are going to explore a common question that we get from a lot of our patients that come in, because a lot of our patients come in with sinus infections. And one of the questions they ask is my sinus infection contagious? Are sinus infections contagious? Do you want to start off with that?
Sure. So a lot of it comes down to thinking about what the root cause of the sinus infection is. And so as we've talked about in the past, a sinus infection in general is from obstruction of the sinus, which then can lead to mucus sitting kind of static in the sinus like a little petri dish, and the normal bacteria or the biome of the sinus gets inflamed and then starts to have like a little party in the sinus, triggering more inflammation. So we always think of or at least I do, think of three different triggers that may lead to sinus infections. And so we typically think of irritants and either work hazards like certain chemicals, smoking. We think of allergens, your typical seasonal pollens and dust and other things that may trigger them. And then we think of viral infections that trigger acute inflammation and swelling in the nose. Do you want to touch base on kind of like some of the most common things that we see for what triggers them?
Yeah, so you touch base on viral infections, and then there's bacterial infections for sinuses. Most people, when they think of a sinus infection, they think of getting a viral infection first. So there's all sorts of different viruses out there, from COVID to parainfluenza to CMV, EBV, common cold. So there's a whole bunch of different viruses out there. And typically what happens when you get exposed to a virus is that you get all the viral type symptoms like upper respiratory tract symptoms and cold symptoms, but you can also get the sinus symptoms. During that portion of a sinus infection, when it's a viral sinus infection, it's very contagious, generally speaking, because viruses generally are very contagious, and viruses can be spread by either direct contact, you touch a surface with the viral particles on it, or it can be spread through respiratory droplets, which is through like kind of liquid in the air from sneezes and coughs, or it could be spread through the air itself as an aerosol, which is much more contagious in those scenarios. So that's, if you have a viral sinus infection, then it's generally very contagious whenever you're having symptoms. But it can also be contagious even when you've, for maybe a couple of days after all of your symptoms have gone as well. And then there's a bacterial sinus infections. You want to talk about that?
So a lot of times after either the virus goes away or the allergy things caused all the swelling, and the swelling doesn't go down quick enough, you may then end up with a bacterial infection. So we typically think of these as an acute sinus infection, one that's lasted less than several weeks, and is typically the same similar symptoms that you would get with the virus, as far as facial pain, pressure, congestion, and then we typically start to see some what we call purulent or kind of yellow, green, brown discharge coming from the sinuses that would indicate that there's a bacteria in the sinuses that's not draining. Sometimes if it's a very mild bacterial sinus, if the swelling goes down and air starts to get back into the sinus, they may resolve on their own without needing any treatments. But often they end up needing an antibiotic or something if it's been going on, especially for more than a week and a half or two. Frequently, they may end up needing an antibiotic to get rid of. These typically are not what we think of as contagious, like you mentioned, which is very key. Like viruses often spread in small or large droplets, and those ones that spread through small droplets are very, very contagious because they aerosolize very easily. Whereas bacterial sinus infections typically are in the nose and sinuses. Sure, if you were blowing your nose and touching the bacteria and then touching things, you could potentially spread it, but those are much larger organisms, and so they don't spread very easily like the viruses do. They don't last long on surfaces like you talked about, like the viruses do. So typically, bacteria we think of are less contagious.
Yep. And usually bacterial sinus infections need the stage to be set prior to getting infected. So, like you mentioned before, maybe an irritant or allergy exacerbation or a previous viral infection where things are already inflamed, and then the stage is set, and then the bacteria then goes and kind of takes advantage of all the inflammation that's already there to create that infection. Um, so generally speaking, I tell patients, this is not like 100% rule, but generally speaking, if they have a viral sinus infection, it's probably very contagious. And if it's a bacterial sinus infection, it's unlikely to be contagious.
Yeah, agreed, agreed. And a lot of that we kind of guess based off of time, the associated symptoms like Dr. Reddy had mentioned, fevers, chills, throat symptoms, like other things that may be indicating some chest tightness or whatever, maybe indicating more of a viral prodrome as well with that infection.
Correct.
Agreed.
Anything else to add?
No, I think that pretty much covers it.
Great. Thank you for joining us.